Well, greetings, everyone. Hello, hello. This is Joyce Davis. I am president and CEO of the World Affairs Council of Harrisburg. And some of you might read some of my articles in Penn Live and the Patriot News, where I'm the outreach and opinion editor. I am just overjoyed to be with you today to have this event in commemoration of Black History Month in our nation. I am also equally delighted to let you know that our sponsor, Highmark, has really, this is the second year that they've come alongside us to make sure that we focus on an important issue for African Americans, and that is health. And this actually in forum that we're holding, of course, was supposed to be held in person at Highmark, but because of the weather that's out there and are not wanting people to risk any kind of accident, we decided to hold it as a Zoom webinar. So that's why we're here tonight for this State of Black Health Forum, a webinar. And before I go any further to tell you the extraordinary speakers that we have lined up for this event, I'm going to ask Judith Wyndham, who is here with us on behalf of Highmark, to offer us a few words of welcome. Hi, Judith. How are you? You're muted. That's all right. There you go. There you
go. Thank you. I apologize for that. And
Not a
good
problem.
evening, everyone, and welcome. Thank you, Joyce. I'm Judy Wyndham, Community Affairs Director at Highmark. And on behalf of Highmark and our Vice President of Community Affairs, Kathleen McKenzie, we are thrilled that you could join us this evening for the State of Black Health Community Forum, even if it is virtually. I am delighted to hand the program back over to our esteemed moderator and guest host, Dr. Joyce Davis, President and CEO of the World Affairs Council of Harrisburg, who will introduce tonight's panelists. We are thrilled, like I said, to host this event again, and we enjoy the partnership that we have with Dr. Joyce. Enjoy this evening's event, and we are glad to have everyone. Enjoy. Dr. Joyce?
Thank you so much. I really, really appreciate your being here with us. And, again, I so appreciate we have had now a strong partnership with Highmark. Highmark really cares about informing our community about healthcare, about health matters. We started this partnership during COVID when people were desperate to get trustworthy, accurate information. And Highmark was there to help us in our efforts to reach out to the community. And we've just got an even stronger handshake now, because one of the things I always say is you can't wait till there's a crisis before you start building trust. So we're letting people know, come here. The World Affairs Council and Highmark are going to give you accurate information. So with that, I am now going to get started on our discussion tonight. And we do have some incredible speakers, people who are not only experts in their field, but really, really are engaged and care about the community. And so I'm going to, as I read their bios, I'm going to ask them to open up their videos. And then after I introduce them all, we will get started. And so our first speaker that I'm going to introduce is Dr. Janet Pasley Clark. She is a nurse practitioner in psychiatry. She is assistant professor of the Department of Psychiatry and Behavioral Health, the Division of Adult Inpatient Services at the Pennsylvania Psychiatric Institute. She is a healthcare professional and a leader with a breadth of clinical experience across the spectrum, caring for patients with behavioral and substance use disorders. She leads transformational change in care delivery and professional practice with a focus on excellence in care. I like that focus on excellence in care. Dr. Janet Pasley Clark is here. And our second speaker is someone that we know well and who's been in previous forums, and that is Dr. Cherie Livingston. She is an OBGYN, actually chair of the department at UPMC Lidditz. She's founding board member of Patients Are Waiting and co-founder of Diversifying Doulas Initiative. Dr. Livingston, let me tell you, is absolutely dedicated and energized for helping women and for making sure we're informed, but that we get good care, but that we also understand. And she's also out there spreading the word in the community. She specializes in obstetrics and gynecology and is board certified by the American Board of Obstetrics and Gynecology. She practices at UPMC Obstetrics and Gynecology Specialists in Lidditz and is affiliated with UPMC in Harrisburg, UPMC Community Osteopathic, UPMC Lidditz, and West Shore. So, welcome, Dr. Cherie Livingston. We'll be hearing from you shortly. We also have with us a quite distinguished gentleman, a retired colonel, James Williams. We all know him as Jim Williams. He is a prostate cancer survivor, and he has been on a mission to make sure men understand that they have to take care of themselves and their bodies. He is the principal of Jim Williams and Associates, Camp Hill, Pennsylvania. It's a consulting firm, specializes in human resource management, prostate cancer awareness, education, and advocacy. Now, before launching Jim Williams and Associates, Jim was the operations manager, human resources at Penn State Geisinger Health System, the Milton S. Hershey Medical Center, and other professional experiences include Director of Human Resources, American Bar Association. So he's done a lot and is still out there doing more. So our last speaker is Carla Johnson. Now, Carla is new in her position as Executive Director of South Central PA Sickle Cell Council. She is a dynamic community leader, for one thing, and she is devoted to fostering positive, proactive community engagement and for creating pathways for both personal and professional growth with all those with whom she works. As the director of the South Central PA Sickle Cell, Carla leads with a strategic vision and a deep commitment to addressing health disparities relative to the core mission of the organization. In this role, she focuses on first advancing education, building support for what she's doing for her mission, and securing the necessary resources for individuals and families who are coping and struggling with sickle cell disease. Now, Carla is also founder of Blessed to Give, a nonprofit, and is devoted to also empowering youth in the city of Harrisburg. That's a noble thing to do. We need to empower our youth everywhere. So, with that, we have introduced to you our distinguished group of panelists. So, without further ado, because they have a lot to say, I'm going to turn it over to Dr. Janet Pasley Clark. Janet, you want to start?
Yes, 1 minute. You all can see my screen?
Now we can, yes. Now we can.
Okay, and let's see. Hold on a second. Trying to see how to.
Just go to slideshow at the top there. Click on that slideshow all the way at the top. So all file, just go to slideshow and click there and it'll come on.
Don't see it now.
Go all the way to the top.
I am all the way to the top, but now I don't see slideshow.
Maybe you have, well, you can just do it that way because we can at least see the sides, but you know where you do file and home where you, if you wanted to.
Okay, let me, there you go.
There you go. And next is slideshow. Excellent. All right.
Okay, can you see the slide now?
Well, you have, we see the slide, but I think you have to now go to the bottom and enlarge it.
Okay.
Or no, or start from, click slideshow, click it again.
Let me click it again.
Yeah, click it twice and then that will bring, there you go. You've got it.
All right.
Good.
Okay, so welcome everyone. Thank you all for having me today. My name is Janet Pasley Clark, and today I am going to hopefully give you an overview of the state of health equity for Black Americans. And I hope that this gives you some areas of reflection as we move forward with tonight's conversation as presented by my many esteemed colleagues. Okay. So what does it mean to have health equity for Black Americans? Martin Luther King said in 1966, I'm going to paraphrase this, that injustice in health was the most shocking and the most inhumane because it often results in physical death. More than 5 decades later, we no longer have formal racial segregation of healthcare. However, health disparities research done by social epidemiologists and others affirm the pervasive role of racism in health status and access to health care. Today, healthcare disparities are deeply rooted in the past. So before we speak of present day, there is a need to reflect and recognize that US policies and events reflect ongoing impacts of racism on multiple levels, including systems, structures, policies, and interpersonal interactions. Understanding the past and how it shapes present-day disparities helps to inform and guide efforts. It is also essential to recognize marginalized people's resilience in these challenges and disparities, and to consider how to build on their strengths by prioritizing community engagement and leadership to moderate disparities and improve overall health and well-being. There has been and continues to be inequities in the medical profession towards the Black population. Historical cases include finding a cure for fistulas, including experimentation on Black women by J. Marion Sims, forced sterilization of low-income women of color in the 1900s, the Tuskegee experiment, in which the US public health system left poor Black men untreated for syphilis for over 40 years, and the adjustment in reference to self-procurement at the expense of Henrietta Lacks. More recently, a study sought to examine the beliefs of white medical students and residents about the biological differences between Blacks and whites. The results showed that false beliefs continue to permeate the treatment of Blacks, such as Blacks are less sensitive to pain and our blood coagulates more quickly and is thicker. Believe it or not, 40% of the participants believed at least one of these myths. Another recent study showed that Black women post C-section were not afforded pain medication at the same rate as their white counterparts. Recently, last week, I think Robert F. Kennedy, during his confirmation hearings, cited a Mayo Clinic team study focusing on the differences in vaccination immune response by race. Data showed higher antibody response amongst Blacks after receiving the MMR vaccination compared to whites. However, the study's author advised that the data Kennedy cited did not support the belief that the vaccine schedule should be changed in reference to and based on race. How do these false beliefs influence up-and-coming providers as they care for Black population? Although science has disproven these theories, these beliefs permeate the US health system. Today, Black adults are more likely than whites to say that they have been mistreated or disrespected by a healthcare provider due to their race and ethnicity, and to report specific negative experiences, such as having a request or question ignored. Over half of Black adults say that they feel that they have to be more conscientious about their appearance when they attend healthcare visits, and roughly 3 in 10 say that they prepare for possible insults from providers or staff during their healthcare visits. It is interesting that Black Americans are more likely than whites to view racism as a significant problem in healthcare, and less likely to say that they trust their providers to do what is right for them. It is generally known that Black Americans are faced with a plethora of health disparities as compared to our white counterparts. These disparities run deep, and Black people are likely to suffer chronic conditions such as diabetes, hypertension, heart disease, and asthma. The top three leading causes of death amongst Blacks are heart disease, cancer, and non-intentional accidents, not to mention mental health care, which Blacks tend not to access. Being Black in America may mean living sicker and dying earlier. So, what does this say about the health of our nation? The US is the wealthiest country in the world. We spend more on healthcare than any other country. However, our infant mortality rates and maternal mortality rates are higher than many other nations. Our life expectancy is lower. Since we are spending so much money, and if healthcare was more accessible, would the Black community be healthier? Would we want to be involved or engaged in healthcare from a preventative standpoint? It is important to remember that the effect of racism is pervasive and entrenched in healthcare, whether it involves a single patient who is not afforded treatment or is steeped in health policies. Now, my colleagues are going to give you some statistics in reference to their area of expertise, but I'll just give you some. Black men have higher rate of death and disease than any other racial group. Black babies are 4 times as likely to die from complications related to low birth weight. Black infants have 2.9 times higher the SIDS mortality rates. Black mothers are twice as likely to receive late or no prenatal care. And cancer mortality in Blacks has increased even though we are screened more often than our white counterparts. During COVID-19, the hospital rates and deaths of Black folks were much higher. More Blacks are uninsured, and healthcare costs are 20% higher in Black households than in other households. Some other hot topics include mental health, women's and reproductive health, equity-centered policies, HIV/AIDS, tobacco and menthol consumption, food, nutrition, and also the effects of COVID-19. So, as we reflect, what does this mean towards Black Americans? There may be a tendency to stand in reference to religious anger, righteous anger, but there really is a call for engagement, which is strong. So how do we accomplish this? And I'm going to put out a few things just to start the conversation. Really looking at diversifying our workforce. The lack of diversity is really rooted in historic actions, such as there was a 1910 Flexner report, which proposed the closing of medical schools. Now, in today's world, in the US, there are only 2 Black medical schools, Meharry and Howard. Recently, the Supreme Court banned funding of DEI programs, and for the 3rd year, Black student enrollment in medical schools across the country declined. And in 2023, it fell by 11.6%. In 2022, Black representation among registered nurses reached its highest point, with 14.5% of all nurses identify as Black, despite making up 13.6% of the overall population. Also, when we look towards rulings on the federal level, there are concerns that the rulings will erode diversifying the healthcare workforce. Beyond the healthcare workforce, we really need to look at underlying structural inequities in social and economic factors, which are a major driver of health. A lot of the times, Black folks are living in urban areas. Some of these areas, or maybe most of these areas, lack resources to support health and pose environmental risk. They may have less access to education and employment opportunities, food options, green space, and fewer transportation options, making it difficult to access health coverage and care and pursue healthy activities. This results in the Black population being prone to environmental and climate-related risks, such as exposure to heat, lead, population, toxic, and/or hazardous materials. When we look ahead, we look at medical advances, which may benefit the Black population. However, we are historically underrepresented in clinical trials, and this underrepresentation reflects structural access barriers, such as limited access to trial sites, less access to transportation and technology, and limited eligibility for trials if being uninsured and having an underlying condition excludes folks from participation. So when we look at new drugs, these out-of-pocket costs may be high, which create a financial burden for Black people due to underlying inequities in coverage and income. The bias in clinical decision-making processes and limited provider access may also inhibit care. I guess the new shiny object in healthcare is now clinical algorithms and AI. And they are used to really guide clinical care. However, if the algorithms are based on bias, such as race, that may also contribute to disparities in treatment. Algorithms may result in biased treatment if they are built on underlying data that is biased and not representative of a diverse population. However, there are opportunities to really look at how these algorithms are designed and reduce bias in treatment and care. So this ends my overview in reference to the state of health equity for Black Americans, and I now turn it over to my esteemed colleagues.
Well, Dr. Pasley Clark, that was absolutely excellent. I mean, it provided us just an overview that just took into account so many issues that I think that we are prepared to kind of delve into now. But the overriding thing, and I'll come back to try to ask you some things, because the overriding thing that you've mentioned here is the persistence of racism, structural racism, and its impact on our health and
Yes.
our well-being, and when we die and where we die and how we die. It's all connected to this system. So we will come back because you have given us a lot to digest and to talk about. But now we're going to step into focusing a bit more and focusing on an issue that I know Dr. Cherie Livingston is quite passionate about, and that is women's health and mortality rates for Black mothers. And you raised, Dr. Pasley Clark, you raised the issue of the infant mortality rates being so high. So let's move on. You can stop sharing your screen now, or maybe I can. There you go. And maybe we can now turn it over to Dr. Livingston. Dr. Livingston, I will try to pull up your slide as well as you're talking. So go right ahead.
Absolutely. Thanks for having me, Joyce. I'm so honored to be here. And with this amazing panel, Dr. Pasley Clark, that was just very fruitful and helpful. And you guided us in and started us off wonderfully. I'm honored to be here. I will give you a little bit of my background. I'm an OBGYN physician. I'm very passionate, as Joyce said, about women's health. Um, I was born and raised in Harrisburg and did my residency at Penn State Hershey. When I left Penn State Hershey, I came to Lancaster, and Lancaster is the home birth capital of the state of Pennsylvania. So when I looked to my right, I saw a doula, and when I looked to my left, I saw midwives. So I've grown up as a doctor with an amazing workforce, the perinatal workforce, and we will and continue to improve the lives of birthing people through strengthening the perinatal workforce. And when we say perinatal workforce, of course, we are referring to all of those folks who touch birthing people, from nurses and doulas and doctors, hospital administrators. So with that said, I'll get into my opening line. Anytime I talk to my students or residents, medical students, nurses, I always start off by saying that Black people are doing well. I know we jump right into the dismal statistics, but all is well. We are a force to be reckoned with. We are doing great things. We continue to remain on good pathways regarding mental health, physical health, spiritual health. We are doing great things. And I think that the world continues to tell us otherwise. I love that we are centering ourselves. especially in these times. But I think it is so important to start with that we are an amazing people doing amazing things, and that all will be and can be well because we are so strong. With that said, we can walk and chew gum at the same time. We can acknowledge that we are an amazing, fierce group of folks and recognize the statistics that I'm going to dive into. So I have my notes here. I don't want to misstate because I just don't believe in that. But 50% of young girls, young Black girls, will get diabetes unless they remain active and improve their diets. 50%. So when you're standing in a classroom full of fifth graders and sixth graders, if the data go in the direction that they have, 50% of those Black girls will develop diabetes by the age of 55. 82%, exactly, that's a lot. I agree. I can see the text, the chat. 82% of Black women are over a healthy weight. So let that sit. 53% are considered obese, obesity being defined as a body mass index over 30. 137 Black women die every day from heart disease or effects from that. Now, I don't know, panel, raise your hand if you've flown within the last 5 years. Right? So the average number of people on a medium-sized plane is 137. And we've been talking a lot about planes these days. That's a plane a day full of Black women going down. Let that sink in. So 137 Black women die daily from heart disease. And remember, preventable. I love what Dr. Pasley Clark started off with. Most of what we're going to talk to you about tonight is preventable. That's a plane going down a day, which means tonight's event, along with many others, means we have a sense of urgency. And that's why we all wildly accepted Joyce's invitation to speak tonight, because we do have this sense of urgency. But why? We have government intervention. We have private weight loss companies. We have public health campaigns. So folks may be saying, well, we have all of these things. Why are we seeing the obesity rates, diabetes rates, chronic hypertension, depression, and anxiety? Let's have that conversation. Studies show that 1 in 2 Black women meet the criteria for depression and anxiety. Doesn't mean they're talking about it, doesn't mean they're acknowledging it. And that too is the unfortunate part. That's a statistic that we should demand that we change, and we will talk about changes. So Joyce, if you can put my slide back up, I like to focus on the solution wheel, because we can perseverate about statistics. I'm an OBGYN physician, and Black women, Black birthing people are 3 to 4 times more likely to die in childbirth than white people. And I do not say white counterparts. I am very intentional with my language. Black birthing people, Black women. Postpartum depression is seen in about 1 in 5 birthing people. It is more common in Black birthing people. We have to dive into the why, because in order to understand why this is happening and create solutions, pathways of solutions that you see, we have to dissect this 5-part wheel, which anytime I'm talking about the maternal mortality crisis or gynecologic issues like ovarian cancer, 1 in 70 women will be diagnosed with ovarian cancer. 1 in 8 women will be diagnosed with breast cancer. Cervical cancer, 71% of Black women are more likely to die of cervical cancer than white women with a cervix. That's unacceptable. So as a gynecologist, I focus on preventive care. So I talk to my patients about Alzheimer's, heart attack, bone disease, cervical cancer, ovarian cancer, uterine cancer. We're seeing an uptick in uterine cancer because uterine cancer is typically fed by estrogen. And where is estrogen stored? In fatty tissue. And what did we just say? 83% of Black women are above what we call a healthy weight. Now, we can debate. I'm not fat shaming. I get it. Um, who are we comparing to? I know some very healthy people who are obese, and I know some very unhealthy people who are very skinny. So it's not that fat equals unhealthy, skinny equals healthy. It is understanding the fact that most of us have room for improvement for being healthier. And so when we look at this wheel of solutions, I know people like to start with a patient and telling patients, well, you're not doing this and you're too old and you're too big and you're too this. I don't start with patients because I think that most of the issues lie within the system. And so I focus on the organizations. There is independent racism, there's systemic racism, structural racism, and racism is the bedrock of racial health disparities. And what are health disparities? Health disparities are just that, differences. They're health differences. I'll give you an example of a health inequity and in health inequality. So when you think about health inequality, think about the likelihood of heart disease in a 16-year-old versus a 66-year-old. Well, that's health inequality. You can't do much about that. 16-year-olds typically have healthier hearts than 66-year-olds. That's an inequality. Inequity is a health difference that is unjust. So, for example, the incidence of diabetes in BIPOC communities versus white communities. It is unjust when you can do something about it and the system chooses to not do something about it. So, for example, these are inequities: the incidence of depression and anxiety, the incidence of chronic hypertension and heart disease. When you hear people say, oh, it's in my family, it's not in your family. These are chronic conditions that we can fix. But when I say we, I mean this wheel in front of you. We must dismantle systemic and structural racism. And why must we do that? Because we won't fix any of this. Remember, race is a man-made construct. We are all genetically similar. Now, how our genes are expressed is based on what Dr. Pasley Clark was talking about. I don't know how many of you have read the book Weathering by Arlene Geronimus, but you need to read it. Weathering talks about how our cells age more rapidly when we're under stress and duress. It's an excellent read. Another book that's great to read is Say Anarcha. And Dr. Pasley Clark talked about that as well. So Anarcha, Betsy, and Lucy were three enslaved teenagers. They were 14 years old. They were enslaved teenagers who were repetitively raped and gave birth too soon and developed vaginal fistulas. A fistula is a tunnel that connects two organs that should never touch. And so J. Marion Sims, who used to be called the father of gynecology until some smart humans removed that title from him, and he went down to Alabama and worked on Lucy, Betsy, and Arca without using anesthesia. So can you imagine? A shot hurts, let alone someone on your perineum inside of your vagina trying to repair fistulas without, under substerile technique, without anesthesia. So this is what I mean when I say we have to dig deep into dismantling systemic and structural racism. And medical students must be taught about these things. Otherwise, we're going to continue to see the studies that came out of Harvard that showed that Harvard medical students thought, when probed and asked through a questionnaire, that Black people experience pain differently than white people. So community. I started an organization called the Diversifying Doula Initiative. Like I said, I'm a doctor who loves doulas, and that's because I was taught by a wonderful mama who said one person can't go it alone. You have to recognize the fact that teamwork gets the job done. And so, as an obstetrician, I recognize that doulas are definitely helping to improve maternal health outcomes, as are midwives. And so, community matters. And if you want to help the community, talk to the community. And if you want to help Black people, talk to Black people. We have the solutions. Like all of this dancing around, acting like there's like some scientific algorithm that's gonna like correct all of this. No, talk to people. The solutions live and lie within the communities. Government, we can't do anything without government, right? We have to legislate these things. When I talk about improving maternal health outcomes and gynecologic health outcomes, we have to provide evidence. So that's why we do qualitative and quantitative studies so that we can measure what matters. Because if you're not measuring what matters, then you don't know the impacts of what we're doing. And government needs this very pragmatic and practical information so that we can create policies that help to move the needle. Healthcare providers, myself, we must address implicit bias. Bias is the brain shortcut. So run from the person who says that they don't have bias. They're lying. We all have bias. Bias is the brain shortcut. It's a shortcut. However, it's implicit bias that yields abnormal health outcomes. When a Black woman shows up in the emergency room writhing in pain from an ovarian torsion, and someone thinks she's drug seeking and just wants opioids. And now we're 16 hours too late and she loses an ovary, or she's in the middle of a sickle cell crisis. So we're working at my other organization, Patients Are Waiting, where we're educating young people very early on to understand what health disparities are and promote health equity and address health inequities. Young people have to learn this early on so that we can be ambassadors to improving health outcomes. And then I'm going to finish with the patient. We would be disingenuous if we went through this wheel and didn't say that patients can present to doctors' offices, um, clinics, ERs with the ability to improve their health as well. That would be disingenuous. People can improve their health. And what I tell my patients, I saw 33 of them today, is there is always room for improvement. There is room to be healthier. As Oprah told us, add ER to any word. Don't walk in and say you need to be healthy. Just that there is room to be healthier, because all of us have room for improvement. And how can we do that? Work on our mental health. Walk 30 minutes a day as much as you can. Walking actually is the best form of physical activity. Nobody's saying go to the gym and spend 6 hours in the gym. Heavens knows I can barely, crawl out of bed, let alone go to the gym for 6 hours, but just walking, drinking lots of water. I just watched Carla take a sip of water. Exactly. Like just drink a lot of water, walk, work on your mental health, have healthy relationships. I'm going to finish by just giving you these 4 bullet points. And if you're writing and taking notes, please feel free. Number 1, do not wait. Self-care is an act of revolution. Do not wait. What you're learning tonight, start tonight. Number 2, when you learn a better way, grab someone, grab a friend, grab a relative, and show them the way. Number 3, rally your allies. We have enough enemies. Don't make the good folks your enemies, right? Like, I mean, if you have allies, rally them. I have my organization, Patients Are Waiting, in DDI. I'm always calling on my allies to come help me out with teaching young people and working to diversify medicine. For the past 60 years, there have only been, the number of doctors and surgeons that identify as Black has been unchanged at 5%. We're working desperately to improve that number. Number 4, find joy. Find what makes you happy and explore that. And just we are, I'm going to end where I started. We are an amazing people. You're going to hear some rough statistics tonight, but we are doing well and we will be well.
Oh, I'm full of joy now. Thank you, Dr. Livingston. You know, she's right. I mean, when you think about our history, when you think about everything that we're dealing with, we truly are an amazing people to have survived and thrived, right? So thank you for that. Yes, we are, and we know we're facing tough times right now, but we've got what it takes to overcome. So thank you. You've got me filled with joy. I'm ready to shout. So thank you. All right, we're gonna move on right now to a good friend. He and his wife are just so well known in our community. They're such anchors. They're just people of character and care. I'll say that. And that's retired Colonel Jim Williams is with us. And Jim, I'm going to do the back end for you with your PowerPoint, but you come on and take the show. Are you on? Let me make sure you're unmuted. Let me unmute you here. There you go. You're unmuted now.
Okay. Thank you, Joyce, for
You're
that
welcome.
great introduction. I didn't know who you were talking to. It's great to be with you this evening. We just heard two fine, outstanding presentations by health professionals. Now we're going to talk a little bit about the consumer and the layman's point of view. I'm a 33-year survivor of prostate cancer. And presently I'm in the prevention business. And in that, I want you all to become informed consumers. We're talking about the state of Black men's health, but more than that, I want to talk about the elephant in the room that prevents us from many cases getting the care that we need. Next slide. We heard some statistics about what the problem is, and I'm not going to dove too much in it. But as far as men's health concerned, as far as prostate cancer is concerned, we're going to lose 34,000 men for prostate cancer this year. It's a deadly disease. I spent 2 combat tours in Vietnam. That was a 10-year endeavor where we lost 50,000 men in 10 years. We lose more men to prostate cancer in 2 years than we did in a 10-year war in Vietnam. Next slide. So what is the elephant in the room that I referred to? Next slide. The bottom line is that we don't have a healthcare system in the US. We have a sick care system. And this system is driven by a fee-for-service payment model, which is reactive and not proactive. And we must turn this paradigm around if we're going to gain better health for our citizens. Next slide. What does fee for service mean? Well, it means that the insurance companies or the professional government agencies are billed for every test, procedure, and treatment that they render when you visit the doctors. The payment model rewards physicians for the service provided regardless of the outcome. And so we as laymen are trying to turn the system around so that it's more value-based and patient care centered. Next slide. We must develop patient-centered payment models and move from a volume-based system to a healthcare system that promotes wellness. Next slide. Physicians providing quality care will have to answer for their actions
Oops.
or see reduction in their reimbursement. The whole idea here is that we must improve the health, lower the costs, and integrate our care better. Next slide. Just a short example real quick of what we're talking about. You see here that the nations, industrial nations of the world, and the mortality tables, where we find that citizens in other countries are living a lot longer than we are, and spending a lot less for healthcare than we are. Next slide. Let me tell you a war story. In my second tour in Vietnam, I was a advisor to Vietnamese soldiers in a province south of Saigon. One day, my counterpart told me that he has fired his doctor, and I asked him why. And he said, because he got sick. And I really didn't understand that. But you see, in Eastern medicine, you go to the doctor to stay well, to stay in balance. It's the yin yang principle. And because he was coming up with illnesses, he felt that the doctor wasn't doing his job, which is quite a reversal from our reactive system in the United States. Next slide. So the preventive messages, and especially in the Black community, is that we must have regular checkups annually to visit the doctor. Men take better care of their cars than their bodies. I often ask men, why did you get the oil change? Was the car sick? No, but men understand that preventive maintenance, inspections, and keeping the car in good shape extends the longevity of the car and cuts down the cost. And it's the same thing in healthcare. But with our reactive system that's driven by diagnosis and treatment, it's based on quantity and not quality. Also, men, especially Black men, do not really understand the importance of screening and what baseline numbers and what that means, and the type of screenings that are available. Next slide. I think we all agree that early detection is the key. And in prostate cancer, we have two tests. One is called the digital rectal examination, and one is the PSA, which is the blood work. Next slide. Next slide. This is the tool that many men will not go to the doctor. We say here, don't fear the finger. The digital rectal examination. It's a 10-second test where the physician can feel the prostate through the rectum wall and see whether it's healthy. Not that it's cancerous, but whether it's healthy or not. I often tell men, ask your wife the examination they go through each year, and it's more than just 10 seconds. But because men don't understand the importance of this test and have all kinds of sexual relations, sexual visions of this examinations, they refuse to get this test. And that causes them problems because it is an important test. Next slide. I wanted to talk to you for a few minutes about the things that I hear on a day-to-day basis, especially when I'm talking to Black men about prostate health and prostate cancer. They tell me that, I'm okay. Why do I need to deal with this? I got other pressing problems. My plate is full. It's God's will. It is what it is, and it's in His hands. People told me when I was diagnosed with cancer that you went to the doctor, you were well, you came out, you had cancer. Why would I want to go to a doctor? And staying healthy is expensive. Men, next slide. Men don't like to appear weak and not in control. When it becomes necessary to handle, it's none of your business. Suck it up. It's what I hear all the time. Next slide. It's a big C, and within our community, believe it or not, when I was growing up, we didn't talk about cancer. It was called the big C. It was to some people a sin. It was a curse that you had to deal with. Distrust of the healthcare professionals, as previously been stated, is often a barrier in our community. And the procedures are unpleasant, as we talked about before, uh, rectal examinations and drawing blood will stop people from this disease. Men need to understand the importance, as I said before, of the baseline numbers. And all these screening tools are not perfect. They have high false positives and false negatives. We have no consensus within the health community as to whether men should be screened or when they should be screened or what tools should be used. But from a layman's point of view, the beauty of screening is that having that baseline number allows you and the health professional to track your prostate health through annual examinations. The problem with the screening tools are that they have high false positives and false negatives, which means you might have low numbers and have a problem, or you might have high numbers and not have a problem. But by having a baseline number and comparing that with future examinations is the key. For instance, we talked about the DSA, the PSA, and if you have a number 2 and then the next year you have a number 4, that number is doubled, that might be a problem. Whereas if your baseline number is 8 and then the next year it's 9, that might not be a problem. And so the physician can be sensitive to these numbers and look more thoroughly into what's going on with your prostate, because this all happens before you have any symptoms. And that's why having these baseline numbers and having these early screenings is very important. Next screen, please. I don't see the screen, so I don't know exactly. Where are
So
we?
barriers that often are not addressed.
Okay.
Concern, yeah.
Okay, that are not often addressed.
Concern about the quality of medical care,
Yeah,
transportation.
yeah.
Yeah.
These are the barriers that we've talked about before. The concern about the quality of Medicare, transportation, the appointment schedule, and the paperwork shuffle that many people have to go through, and many feel that the treatment may result in sexual dysfunctioning. All men have prostates. All men's prostate enlarged that causes quality of life problems during their lifetime. They're not most times they're not cancer problems, but they are quality of life problems. And that's why men should be as sensitive to their prostate as women are to their breasts. And we need to instill that into our Black community, especially how important that is. And when I talk to men, I find out that they do have these quality of life problems, but they don't speak to it. They tell me about how many times a night they have to go and urinate. We have leaking problems, impotence problems, uh, and they just don't discuss it and then deal with it. And the end result is that we don't live as long as our female counterpart. Next slide. And maybe a bigger elephant in the room than our sick care system, which is reactive and really doesn't put a lot of money behind screening and prevention, is that we men just do not advocate for our health. My best audience for men's health are females, not males. And women are my both receptive audience. Next slide. And as I mentioned before, we find that there's very poor quality of life with senior men for a number of reasons that we've already talked about.
Mhm.
So my organization, Pennsylvania Prostate Cancer Coalitions, try to go one-on-one in group sessions, meeting people where they are and speaking about uh, prostate health, prostate cancer, and then with all the things that have been said about DEI and the problems with the system, we also, as Black men, have a responsibility to stay on top of our health, to be aware of prevention, to make that a priority so we can maintain presence in our community. And with that, Joyce, I'll turn it back to you. Thank you.
All right. Well, thank you very much. That was well done. Lots of issues there to talk about, but a lot of them seem to have to do with also just the mentality breaking through to let men know they're not like they don't have to be superheroes. They can reach out for help and take care of themselves. So, thank you for that. And now we're going to move even more deeply into an issue that is definitely impacting the African American community, and that's sickle cell. And so, with that, I'm going to ask Carla Johnson if she would unmute and join and do her presentation.
Thank you for having me. Thank you for having me. I'm happy to be here, and thank you for bringing me on here with these great doctors and educators, and everything has been saying has been great. I agree with Dr. Livingston. We're going to be okay, even though a lot of the stuff that we're talking about is preventive, and we're stubborn and we don't want to go to the doctors. I'm one of them too. I'm bad at going to the doctors. I'm getting over a cold right now. I did not go to the doctors. But I want to introduce myself. My name is Carla Johnson, and I'm honored to serve as the new appointed executive director for the South Central Pennsylvania Sickle Cell Foundation. Our organization oversees 26 counties across central Pennsylvania, and we're working to provide support, resources, and advocacy for individuals and families affected by the sickle cell disease. My journey in this role is deeply personal. I have always been passionate about giving back and building stronger communities and helping others. Like Joyce mentioned at the beginning, I have a 501c3 called Blessed to Give, which I'm the founder, which I have dedicated my work to empower youth of central Pennsylvania, focus more on Harrisburg, Pennsylvania, supporting parents and strengthening community connections. So when I was drawn to this position, because I have a childhood friend who has sickle cell disease, and that's what made me want to go for this position as the executive director. Over the years, I witnessed him in firsthand. We grew up together. We went to school together. He had excruciating pain. He endured with the lack of resources that were available to him. One thing Dr. Livingston said, just a sidebar, is how she said that patients go to the emergency room and they're in excruciating pain, and they're not educated to know that they might come into the waiting room looking like they have a cold, but because it doesn't show on the outside what they're experiencing on the inside. So yes, he had experienced a lot, and his experience made me realize how critical it was to raise the awareness and to advocate for better healthcare. He endured sickle cell his whole life. His sister had sickle cell and she had passed from it. So it's important for those living with it to receive the support that they need. Sickle cell disease disproportionately affects the Black community, but I do want to point out that I do have some statistics, but sickle cell people always say it's a Black disease, but understand that you don't have to be. Just most of it is Black, African American, but you can be other races and get sickle cell. Sickle cell patients are called warriors because they fight through the pain. And we have a warrior within our organization that speaks at our events, and she's from Latino. So it's not just the African Americans that it affects, but it does affect a lot, majority of Black Americans. 1 in 13 Blacks or African American babies are born with the sickle cell trait. 1 in 365 are born with the sickle cell disease. And once you have the disease, it could be severe pain episodes, organ damages, strokes, infections, and it can reduce your life expectancy. Historically, treatment options have been limited and few advancements come with the genetic. It's a genetic disorder, understand that. So one thing that I do want to say is that how it works is, in layman terms, if the mom has the trait, the dad has the trait, if you get together and make a family, then it's a strong possibility that the child could end up with the sickle cell disease. That's why awareness is so important. But rather than me explain everything that's going on with the medically, I have a short video that I want to show. It's called Sickle Cell Speaks. It's on YouTube and it's created by Pfizer. Pfizer is a value partner with the foundation in Central Pennsylvania. And this is an easy video so you can understand the breakdown of sickle cell for those that are not familiar with it. So I'm gonna try to share my screen and show y'all this video. One moment.
Here to tell you about sickle cell disease, an illness that affects over 100,000 people right here in the United States and millions more around the world. The first thing you need to know is that you can't catch sickle cell. It's caused by a genetic change that is passed down from your parents. If a mom and dad both have that changed gene, then the child has a chance of being born with sickle cell disease. Now, let's talk about what sickle cell can do to your body. These are red blood cells. More specifically, these are healthy red blood cells. These little guys are what carry oxygen all around your body to places that need it, like your heart, your brain, and your lungs. See how round these red blood cells are? That shape and the fact that they're super flexible allows them to move through the body without any holdups. That's good. People who live with sickle cell disease do have healthy round red blood cells, but they also have abnormal red blood cells that look like this, a little different and not as round. See that? It kind of looks like a banana, or what they call sickle shape. So, the big question is, why do some red blood cells sickle? It starts with something called hemoglobin. Hemoglobin is the part of the red blood cell that carries oxygen. People with sickle cell have a type of hemoglobin that doesn't carry oxygen as well. After sickled hemoglobin releases oxygen, it clumps together in a stiff rod inside the red blood cell. This causes the red blood cell to become sickled, or banana-shaped. That whole process is called polymerization and is what changes the shape of the red blood cell. Sickled red blood cells are very fragile. This causes them to break down more easily than healthy red blood cells. Picture a jelly donut exploding. Everything is released from the red blood cell, and the entire thing breaks apart. This is called hemolysis. Because the sickled cells break down, there are less and less red blood cells in the body to carry oxygen. When there are too few red blood cells carrying oxygen, it can lead to something called anemia, which can make people weak and tired. This breakdown of red blood cells can damage the cells lining the blood vessels, causing them to constrict or narrow. This is called endothelial dysfunction, and it can lead to an increased immune response called inflammation, which is very painful. When those sickled red blood cells break down, one of the things that is released is a substance called bilirubin. Too much bilirubin can cause the eyes and skin to turn yellow, which is called jaundice. And since sickled red cells are stiff and sticky and don't move freely, they can pile up and block blood flow inside your blood vessels. It's like a traffic jam and can keep the healthy red blood cells carrying oxygen from getting where they need to go. When those banana-shaped red blood cells get stuck in the tiny blood vessels, it can also cause a lot of pain. In the joints and bones, in the chest and stomach, it's called a pain crisis, or an even bigger word, vaso-occlusion. VOCs for short. A pain crisis can last a few hours. It can last days. And it can be so bad that a person with sickle cell may even need to go to the hospital. All of this, the red blood cells bursting, the low number of healthy cells, And the traffic jams in the blood vessels means that less oxygen is delivered to the body, and that can do a lot of damage to important parts of the body, like the bones, organs, and tissues. They all need oxygen to do their jobs and keep you feeling your best. So now you know what sickle cell is and what happens in the body when cells sickle. Sickling happens every day. The traffic jams, the lack of oxygen, they cause damage even when there isn't any pain. That's why people living with sickle cell are warriors. Some of the strongest, most courageous people walking on planet Earth today. They want to live their best lives, and I'm here to cheer them on.
Sickle Cell Speaks is sponsored by Pfizer.
Awesome. Wasn't that a great video? Wasn't he a cutie? So thank you for taking the time to watch that video. I truly think Will did an incredible job breaking down the reality of what sickle cell disease is. Now that you've seen that, I hope y'all understand why I'm so passionate about the fight and why I stepped into this role. Sickle cell is considered a rare disease, and because of that, too many people remain unaware of the impact that it has on the body and has on people. But that does not mean we have to stay silent. My mission, South Central Pennsylvania Sickle Cells Foundation's mission is clear. We want to increase awareness, educate families about sickle cell traits and disease, and empower them to make the informed health decision. Again, like I said earlier, when the mom has it, a lot of times what happens is people don't know that they have the trait. And then you hook up with someone, or you date or marry someone, and they have the trait, and not knowing that both parties have the trait, and then you have a baby, and then you have a sickle cell disease. It's like a 25% chance of the baby, if you have two traits come together, with them having the disease. So it's not that they couldn't have the baby or they shouldn't have the baby. It's just that you need to be aware and make an educational found decision before y'all get together and create a family. We also must, and with a lot of people said on this call, that we need to advocate for better treatment for Blacks. You know, we don't have the funding that we are needed, and a lot of times we don't have the correct care. So it's real important for us to advocate for research funding and better care and equitable treatment for all. Since stepping into this position at the end of December, I just started in December, we've already taken action at Sickle Cell. We had an awareness dinner last month, and in March, we're having a health and wellness seminar, a space for education, resource, and community. And in July, we're hosting a golf tournament for a fundraiser to push the movement even further. Also, we're trying to get into the schools. We're starting with CDE, Central Dauphin School District, and we're going to have an event there to bring awareness, to talk to the nurses, to talk to the community, to talk to the parents. If you think about it, if a child goes out for a sport and they don't know that they have the disease, and now they're playing a sport, when athletes start running and they intensify their exercise, the red blood cells can warp into sickle cell shapes. It could block, like he was showing you the stop sign. It could block, and then that could lead to muscle breakdown, and it could lead to your oxygen, lack of oxygen. So it's you want to catch, like everyone said, it's not preventive because it's genetic, but you can start treating it at the beginning, and you don't want to wait until your child falls out on the field and you don't understand why, you know, and it's because they had the disease. So I think it's important for people to be aware of the disease. It's not as big as cancer or some other diseases. So a lot of people are uneducated on it. So that was my whole goal in this position, to bring awareness so people can understand what's going on. Thank you for your time.
Thank you very much. And you're right, he was a cutie. He
was a cutie.
Was. Yes, we could listen. He's also a cutie and smart. You know?
Yeah, Will's amazing.
Cutie. But thank you for sharing that and making it really interesting for us to kind of digest. Before we go on, I do want to ask you, though, hasn't there been some advances, some breakthroughs with sickle cell?
There has been. But I think one of the things, like if you think about just our area, there's a lot of trials, you know, but in our area, there's those advancement are not at all the local hospitals. So they have to travel, to the closest one. I think they have one in Penn State, Hershey, but they don't have to travel further. So if you're having a crisis and you live within the city, like some people can't get there, or like I had the person I was referring to earlier, he went to, I don't want to call out the hospital, but he went to a local hospital and he sat in the emergency room for like 8 hours because they didn't know that, they don't understand what the crisis means, and he told me that was like 3 months ago. And it's like, we have to do something to advocate for the warriors so they can get better treatment. And a lot of times the treatment is good until 18. And then when they go through that transitional period of an adult, the treatment isn't as good. They focus a lot on the youth, which is good, but I mean, you need it forever. So that's another thing that it needs worked on, the transition from youth to adult.
Okay. And there is no cure yet? There is, no. Okay. All right. Well, thank you. You all were absolutely incredible in making complex issues very easily for us to understand. But I'm going to throw out a question to you guys that, just to start us off, that I think we have to address. And that is my concern that so much of what you are doing and so much of you that you're talking about, from sickle cell to women's health, and requires a community to be behind you, and especially you mentioned government to be supportive. And I want to keep my joy, but we have to talk about what are we going to do these next years when we may not have a government that is supportive of our people and our health care. So I don't know if who wants to take that at the beginning, but it is something we have to figure out and discuss. What are we going to do if we don't have government support? Do you want to take that? Go ahead, Dr. Janet.
I think one of my, I guess, pet peeves is really that we're not at these tables. I don't know if it's that we don't know, or we just think someone else is going to do it. A lot of times when I represent, whether I'm representing Penn State Health or whether I'm representing the Hospital Association of Pennsylvania, I'm the only one that looks like me. That's it, right? And so you get, and sometimes it gets tiring to be the only one that looks like you in a situation. But you also realize that there's no one else, right? And so part of it is really being at the table. My husband always says to me, when are you going to say no? And I'm like, well, if I say no, then who else is going to show up? So I definitely believe in being politically active in reference to areas that deal with Black health and health in general. The other thing I think that we really need to do is to mentor our folks. It's wonderful to mentor everyone, right? But it's really important to mentor our own.
Yeah.
So that we start seeing people that look like us when we go to the doctor's office or we go to a community center. It's hard when you don't believe that you have anything in common or that person will understand your point of view. So I think really being engaged in the community, engaged in organizations, whatever organizations that you're involved in. I mean, whether it's considered social or political or community-based, it's just important to put yourself out there and be okay with being the only one or one of few.
Mm-hmm. Well, and I will say Terry is saying in the chat here that we don't have government support. Not what if we won't. She says we don't. But Dr. Livingston, do you want to comment on that?
Yeah, I think that who is doing the caring matters. Research shows that diversity in medicine does matter. Studies show that if you have what we call cultural congruence, healthcare providers that look like you or have similar lived experiences, you're more likely to adhere to preventive care. as Mr. Williams was talking about, prostate examinations and PSA that's preventive care. You're more likely to adhere to treatment regimens. When I say, as an OBGYN physician, get an annual mammogram, maybe one is more likely to trust that and not feel as though they're being experimented upon. And third is you're more likely to participate in research and be a researcher. See, we don't just have to be researched on, we can be researchers. And so studies do corroborate that. There was an excellent study that came out of Oakland, California regarding cardiologists. And they took a cohort of Black men that were cared for by white cardiologists and a cohort of Black men that were cared for by Black cardiologists. Doesn't mean white cardiologists aren't doing their thing. But this particular study out of California showed a decrease. You're in Oakland, okay. This study out of Oakland, California showed that there was a 19% decrease in myocardial infarctions. That's our fancy word for heart attacks in the cohort of Black men that were cared for by Black cardiologists. Who is doing the caring matters. So when we talk about government, what we hope is our government friends are smart and thinking individuals. Some may not be, but hopefully most are. And when we provide them with data like that, you can't turn away from facts and substance. And so I think we keep one, speaking truthfully, factually, and sharing the data. There are 5 things that I think that government can do, especially from a maternal health standpoint, and that's paid family leave. Because if people do not have to rush back to work after they give birth, they care for the family, infant mortality rates go down. Chronic condition rates go down. Number 2, we have to promote telehealth. Number 3, data sharing, data collection. If hospital A shares information with hospital B so that when somebody shows up in the emergency room, they're able to expedite care. I don't know if you've ever heard of the Momnibus Act. Again, I'm an OBGYN, so that's in my lens. It's in my rearview mirror. That's how I see things. The Momnibus, it's a bill with 12 bills that are trying to promote health and wellness for women and birthing people, paid family leave. And then the 5th is just having this access to Medicare and Medicaid and extending that past the 6 weeks of childbirth. So I hope y'all are taking notes, because think of just those 5 pathways. I know we are in frustrating times, but as some folks said before, we've been here before, and we can press forward. Facts matter. So if you can sign up to participate in research or be a researcher, if you're a young scholar, think about paralleling your career with research so that we can prove that these things work and present that to government so that we can get policy change.
Very good. Carla, I know you were ready to speak. Go ahead.
No, I wanted to piggyback off of Dr. Livingston. I think it's important what she was saying about the emergency room and like the paid time off. And a lot of times that affects, like, even with sickle cell, because a lot of jobs see that you always have to call off work and you don't have the time, and then you end up getting fired, because again, they're not educated on the pain that you go through. They don't see it on the outside. You don't have blotches on your face. So, so they don't think that you should be off work and you end up fired. And I think the lack of resources, or the lack of financial resources, is a big thing in the Black community with healthcare. Like with sickle cell, they do have like gene therapies that can help with like change the DNA and stuff for sickle cell, to as far as like a cure. But like, how many people can afford that? And how many insurances is paying for that system? I also think when at the beginning, when you talked about legislation, I know that we feel like we can't do anything about what's going on with the president right now, because it's bigger than us. I mean, just it's bigger than us. But you also have to focus on your local government. Like, we do have control over our local government. We do have control over who we put in office. If it starts from judges to House of Representatives to senators to the mayors, so we do have control. Our vote does matter. And that kind of stuff is important locally, because a lot of bills that we want to get passed, if I want to get stuff put into the hospital, if I want the hospital to share information with me, that comes from the House of Representatives. Those are people we could touch. So it is important to be a part of your local government and understand how that goes. So many people want to say, I don't want to be involved in politics. Well, you have to be involved in politics if you want to make change, because that's where it starts locally. And like, I would love to get to a point, like I said, I just started in December. So I'm not going to beat down the hospitals, but I'm trying to figure out how, like what Dr. Livingston said, like, how do we share information? How do I get the hospitals to, when a sickle cell patient comes there, that you call us? I know HIPAA, there's rules, but like, we're not even aware of everyone because they're not aware of us. Like, how can we help with resources if we don't know who's out here suffering? So I do think that local, like we look at it like the president did this. The president's doing a lot right now, but it doesn't mean we fail. It doesn't mean we can't do nothing. Like, we can still fight. Black America wins. Like, we are strong. We come together and we make it happen. That's what we've been known for from the beginning. So we can still push forward on that area.
That's very good. Yeah, go ahead.
Yeah, no, I'm vibing with Carla, and my problem is I'm like, ooh, I want to meet Carla, and we're gonna come up with some solutions, and we're gonna rock this. I'm a doctor who loves doulas, and although there are not like, I don't want you all to think like, oh, doulas are like sprinkling some fairy juice and all the health outcomes are only going to be resolved by doulas. But I'm like, ooh, two things came to mind when we talk about sickle cell. Remember, there are hospice doulas and there are birth doulas. Maybe when you get a diagnosis of sickle cell, you get a doula who is assigned to you. Maybe not assigned, but you create that collaborative relationship. And in hospital systems, we have electronic medical records. And so, like, if I have a patient who has had a loss, there's something that a pregnancy loss, there's something that shows up on their chart, so that I don't walk in the room and say, are you feeling the baby, or are you still breastfeeding? Like, we give signals to each other. And so I wonder if there's like a signal that we can give in a patient's chart that like they have sickle cell. So we should be mindful of how they're presenting in acute situations. It's all about talking and thinking outside the box. Obviously, that's beyond the scope of this conversation tonight, but that's what webinars like this are designed to promote: conversations, thinking together, pouring gasoline on each other's ideas, and impacting and affecting change.
And even from there, I thought, why don't we have, like, the person who has sickle cell has a contact person, so then they know when they're going to that hospital, they call that contact person. That person then does interference from that, at least know somebody is watching. Right. So the ideas are here. We can make this happen. So, and I do see Cheryl is saying, as a nurse in Harrisburg, I use Care Everywhere to see where locally my patient may have been seen. Wonderful. That's a good nurse. I want a nurse like that really cares. All right. I thought Jim, we must have lost him. I was going to ask him what his thoughts were, but he must have had to sign off. So basically, the other issue that you guys spoke a lot about data, and you spoke a lot. And so one of the data isn't just data here, though. We have to also have data internationally. And, the World Affairs Council cares about the world. I'm a bit concerned, and I don't know if you are too, that we're about to have a cutoff, or already have a cutoff, of the WHO and the World Health Organization, and not being able to share. And I would think for doctors and healthcare professionals like you, that's gotta hurt.
Oh, we're terrified. We're terrified, but I've made a decision to fund my dollars into organizations that will help redact the movement that's happening. I think that we can, If we can pay for a Beyonce concert, I think we can just look for an organization that, and no hate on Beyonce, she's rocking it this week. But, you know, just start to funnel your money where, into small and large organizations that will help us make change. Um, I do agree with you. I feel like there are some big things happening. People's shoulders feel weighted, but uh, you know, money moves things, and I think that's what my husband and I have decided to do. We've looked for both local and macroscopic organizations that we can funnel our money to help make change.
Dr. Livingston, I just want to pause right there. Money matters. And
Yeah.
now, at least in this iteration of the Black struggle, more of us do have some, right? And we need to use that buying power to support those organizations, those companies that are supporting us. Yes,
Exactly.
find those organizations that you can turn to and support for the global health information. But also, I mean, you can't continue to support organizations that pull back on DEI, that don't care about you, right? So think about that. When you see an organization that says they're not there, why spend money with them? And I wanted to
Well,
bring
and when somebody says DEI, I make them say the word, say diversity, say equity, and say inclusion, because then
Amen.
you see how foolish you sound when you say, I don't support, don't say DEI. It's not an acronym. I want to hear you say, I don't support diversity. I don't support equity. I don't support include. Go ahead and say it.
Yes.
Go ahead and say it and see how foolish you sound.
Absolutely.
So I implore everybody on this call, the next time somebody says something about DEI, make them stop and make them say it.
that's really
I put that on my Facebook post last week. Say what you're getting rid of. Say the words, and then you will see how stupid you sound.
But you know, people are I have a DEI role, and people have been calling me for the last 2 weeks telling me that they're scared for me. I'm thinking to myself, and I'm like, what are you going to do? I'm going to continue to do the work. But it is really important that I'm going to stress us being at these tables. Okay? You can put money places, but you have to show up, right? Because your money can go places and you don't know what's going on with your money. So it is really important that we get on boards, we make our presence known. If someone asks us to do something, we show up. The more that we show up and people see that we're coming, you know, they say, I'm coming for you, we're coming, they can't ignore us. So, when we talk about kind of barbershop talk, and I wanted to go beyond that. I wanted to go beyond, okay, we're at the barbershop today, but tomorrow we'll be at Harrisburg at the Capitol. Yeah, that's what I would love to. I'd like to see that parlay.
Right. Colonel, yeah, go ahead. You wanted to, I wanted to bring you in. Go ahead, Jim. You have to unmute though. There you go.
Thank you. I just wanted to piggyback on what's already been said, is that many of the men I talk to don't feel that their voice, their vote, their letter, their comments are that important. And that's been stated. We as citizens have a responsibility to speak up. And we're all here today because our ancestors did speak up, regardless of their education, of their background. They did the work, they did the vote, they wrote the letters, they walked the mile, and we here in 2025 must do the same thing. Health policy in many cases is based on advocacy. It's not based on science, it's based on people making noise. A good example of that is everybody knows that October is Breast Cancer Awareness Month in pink, because the breast cancer advocates, women get out there, make a lot of noise, and people pay attention. We men don't want to talk about our health. September is Prostate Cancer Awareness Month. I wear a blue ribbon and nobody knows what's that blue ribbon about. And so we as individuals have a responsibility. Our voice does count. That going to the Capitol does count. We have to be engaged. And the more we're engaged, regardless of who's sitting in the White House, we can make a difference.
Very good. And to, as you say, be engaged. That's the same thing Dr. Janet was saying, that you have to show up, you have to be on these boards, you have to be in the community. But also, I think we've got to make sure we communicate with our lawmakers. Carla, I think, pointed out, you're right. We can touch the legislators, right? But we don't. We don't.
Yeah,
It's easy to email. We don't even email.
and if there's not a chair at the table, bring a chair.
There you go. There you go. There you go. But I think the message I'm getting is that we yes, we are in difficult times, at least nationally. But the truth is, we've always been in pretty rough seas, you know, and they're not as rough as they were for my mother or my grandmother. So we still, back to the joy, we still have made a great deal of progress, but we can't give up the battle. We've got to re-engage. We, for a Black person in Black History Month to say, to even utter the words, I don't vote. I mean, that is a crime, right? Folks, talk to your families, talk to your, nobody should ever again say, I don't vote, because it's also now so easy to mail it in, right? So I'm going to just say that I've been invigorated, inspired by these incredible people that are here. I'm going to give each one of them an opportunity to offer some final remarks to our folks here. And then we got to get together again and figure out what are the next steps we can do to make ourselves healthier. so who wants to go first? Carla, why don't you go first with your last? Since you were the last, we'll let you go first.
All righty. I want to thank everybody again for having me. And we had amazing speakers. I want to stay in touch. Like you said, we have to show up for each other. I always say I hate having meetings about meetings. We need to actually do action, and we'll be fine. I'll echo off of Dr. Livingston again. If anyone wants to know any more about sickle cell, I'm always available. My team's always available. You can reach out to me. We're located on Lingostown Road, Harrisburg, the South Central Sickle Cell Foundation. And I'm always here for the community. As you know, I'm the founder of Blessed to Give. I love the youth. I love the community. I love our people. And I think we're stronger together. And if we just show up for each other, and we do have to, like a lot of people said, including myself, I'm not the best at, we have to do the preventive stuff. You know, we have to do the stuff at the beginning so it doesn't get bad at the end. So thank you for your time.
Bravo, Carla. How about you, Dr. Janet Pasley Clark?
Well, since mental health is my area, I will say that I really want us to take care of our mental health. There are not a lot of mental health professionals in the US. They really are not. I mean, it's only 2% of psychiatrists are Black. Maybe 4% of psychologists are Black. And when you look around the Harrisburg area, I'm going to say try to find one. Okay. It's almost impossible. So it is really important that we in the community say what we need, right? We need people who have cultural congruence, right? And that can assist us or help us to find someone who we're comfortable with that can assist us, whether it's with therapy, whether it's with family issues, whether it's with medication. So, you know, we at Hershey, I'm located at PPI. There are not a lot of people that at PPI look like me that are Black and professional, but we're here. I would say definitely reach out to us. Let us help you, help us.
Beautiful. Well, you know what you say is very true. I remember we have the World Affairs Council has a special program at the Nativity School of Harrisburg for middle school boys. And one of the things that we were inspired to start a chaplaincy program when the young men had to deal with someone being killed in their schoolyard, basically in front of, because they had no, and then I realized that we can't get a psychologist there because they just don't exist. So we thought, at least let's have ears that will listen, people that have, and so that's what we do. But again, mental health from early on, especially those middle school years on up, is just so important. So thank you for letting us know about your resources. And I will say this in the chat here. There also Holly is telling us, yes, what an opportunity for us now to show up and engage together, not as one group, this group, or a special zip code, but as humans who are showing up for each other. Thank you for that, Holly. Absolutely the right spirit, the right sentiment. So let me turn now to Jim. Do you want to offer your final comments?
Yes, George, real quickly, I want people to realize that, there's nothing more American than the African American. This creature was created by us. We are the fabric of this country, and its survival will depend on us. So many of us feel that we have no voice, we have no power, and that's just not true. We're an integral part of this country, and there's a lot of efforts to make us an appendage, but that's not going to happen. And so we're going to solve this problem. And I'd like to leave on the positive note that we have within our community. We have the power to change the healthcare system and to improve the health within our home and within our community. And so that vote does count, that voice does count, that letter does count. And we just have to work more as a unified force to make it happen.
Very good. So true. And I put in the chat here my recent column, because you basically echoed that. Yes, we are America. We are the very essence of America. And we're not going to stop celebrating Black History Month, whether Washington likes it or not. There's reason to celebrate Black history because it's American history as well. So, well, with that, I'm going to turn it over now for final remarks to our good doctor, Dr. Livingston.
Sure. I just have one thing to say that this group of professionals tonight have taught me. I've learned from you, so thank you for being shoulder to shoulder with me tonight. Joyce, thank you for doing this. 4 things that I'll leave you with. Number 1, drink more water. I mean that. Number 2, get yourself a silk pillowcase. Studies show that if you sleep well on silk pillowcases, it helps you feel better. Get a silk pillowcase. I'm telling you, do it. So water, silk pillowcase, and walk. Just walk. I don't care how often, just walk somewhere and clear your head. And then number 4, adhere to preventive healthcare screenings. So as an OBGYN physician, of course, I am indebted to tell you to do yourself breast exams, get mammograms, get your pap smears for cervical cancer. 1 in 70 women is diagnosed with cervical cancer, ovarian cancer screening. We don't have good screening for that, but pelvic exams, just pay attention to your body. If something changes, share that with your healthcare provider. So preventive care, colonoscopies, bone density testing, get hemoglobin A1Cs, which is a blood test that you can get to screen for diabetes. You don't have to have carbs with all 3 meals. We just cut carbs out, like no bread, no rice. I mean, come on, people. We don't have to have as many carbs. Carbs are good. So drink your water, get your silk pillowcase, walk, and preventive care measures. And I say it all the time to the doulas I work with. I love y'all because love comes in different degrees. You don't have to be deeply in love with somebody, but love equals respect. And if you respect people, it's kind of easy to love them.
Absolutely. That was beautiful. And I will tell you this, I'm getting a silk pillowcase. I usually would just go right to Amazon and buy it, but I'm holding back because Amazon's pulled back from diversity, equity, and inclusion. So I've got to figure out another place to get my silk pillowcase, but I'm getting it. And the water is good. But let me tell you that Phyllis Hicks, who's a wonderful healthcare advocate here for kidney disease. She says, play the long game, invest in HBCUs and Black medical schools, look for the helpers, find champions of all cultures. Very good. Thank you for sharing that, Phyllis. Well, that kind of wraps up everything we have. I love these concrete tips that Dr. Livingston left us, including, let me leave you with this one. During these tough times, during these difficult times, there's still a lot of good, as we're hearing. There's still a lot of good people, great people like the ones here. Find joy in them. Support what their work is. Look for ways to really, nobody should now be sitting back and not volunteering somewhere to help somebody with something. So we have several. We've heard of the doulas. We know about the Kidney Foundation. We also know about sickle cell. All of these are ways that you can get engaged to help improve, to help make African Americans healthier. So with that, I also want to sincerely thank Highmark, and also, because they continue to partner with us, and we're going to do more great things. We may do a big public health conference at some point. And also, my employer, Penn Live, was a sponsor of this. So I thank them for getting behind this and helping us get the word out to our community. So with that, happy Black History Month. Celebrate it. Feel good about being Black. Amen. See you guys later. Thank you all for being a part of this. Bye-bye now.